Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Burns are a common injury that affects millions of people worldwide. They occur when the skin comes into contact with a source of heat, such as fire, hot liquids, or chemicals. Burns can range in severity from minor to life-threatening, depending on the depth and extent of the injury. Understanding the different types of burns, their causes, and how to treat them is crucial for everyone. By recognizing the signs and symptoms of burns, we can take prompt action to minimize damage and promote healing. This comprehensive guide aims to provide you with essential information about burns, empowering you to stay safe and informed. Let's delve into the world of burns and equip ourselves with the knowledge to handle these injuries effectively. Burns are categorized into 3 types: first, second, and third degree. First-degree burns affect only the outer layer, causing redness and pain. Second-degree burns reach the dermis, causing blisters and intense pain. Third-degree burns affect all skin layers, appearing white or charred. Burns arise from various sources, each posing different risks. Thermal burns occur due to contact with heat sources like fire, hot liquids, steam, or hot objects. Chemical burns result from exposure to corrosive substances. Electrical burns are caused by contact with electrical currents. Radiation burns occur due to prolonged exposure to ultraviolet rays. Awareness helps minimize burn risks. Identifying the severity of a burn is crucial for determining the appropriate course of action. First-degree burns typically present with redness, pain, swelling, and mild tenderness. Second-degree burns exhibit blisters, intense pain, redness, swelling, and a weeping or wet appearance. Third-degree burns may appear white or charred, have a leathery texture, and lack sensation due to nerve damage. In cases of severe burns, individuals may experience shock, difficulty breathing, or changes in consciousness. If you suspect a severe burn, immediately call emergency medical services and provide basic first aid while waiting for professional help. Section 5. Seeking help. Diagnosis and treatment of burns. Diagnosing burns involves a physical examination by a healthcare professional. The doctor will assess the size, depth, and location of the burn to determine the appropriate treatment plan. Treatment for burns varies depending on the severity and type of burn. First-degree burns can often be treated at home by cooling the affected area with cool water. Applying aloe vera gel. Taking over-the-counter pain relievers. Second-degree burns may require medical attention, including pain management, wound cleaning, antibiotic creams, dressings. Third-degree burns necessitate immediate hospitalization and specialized care, such as intravenous fluids, wound debridement, skin grafting, pain management. Prompt medical attention is crucial for optimal healing and minimizing complications. Section 6. The aftermath. Potential complications of burns. Burns can lead to various complications, particularly if not treated promptly and adequately. Infection is a significant risk, as burns create an open wound that bacteria can easily enter. Scarring is another potential complication, especially with second and third-degree burns. Fluid loss and dehydration can occur with severe burns, leading to electrolyte imbalances and shock. Hypothermia can develop if a large area of the body is burned, as the body loses heat rapidly. Respiratory problems may arise if the burn affects the airway or lungs. Long-term complications can include chronic pain, joint stiffness, and emotional distress. Essential tips for burn prevention. Preventing burns is always preferable to treating them. Implement simple safety measures to reduce the risk of injuries. Install and test smoke detectors regularly. Keep a fire extinguisher and learn to use it. Never leave cooking unattended. Set water heaters below 120 degrees Fahrenheit. Store flammable liquids out of children's reach. Educate children about burn safety. Create a safer environment for everyone. Section 8. The road to recovery. A final word on burns. Burns are a common injury that can range in severity from minor to life-threatening. Understanding the different types of burns, their causes, and how to treat them is essential for everyone. By recognizing the signs and symptoms of burns, seeking prompt medical attention, and implementing preventive measures, we can minimize the risk of these injuries and promote optimal healing. Remember, prevention is always better than cure. By prioritizing safety and taking necessary precautions, we can create a safer environment and reduce the incidence of burns. Let's strive to stay informed, stay safe, and protect ourselves and our communities from the devastating effects of burns. UMCC, your ultimate medical consultants connectors.